Hello everyone, my name is Nifemi Ayilomi and you are welcome to my YouTube channel, Cleft Care with Nifemi Ayilomi. So today we are going to be discussing a very interesting topic that has to do with children that are born with cleft lip and palate. So today we are going to be discussing feeding of children born with cleft lip and palate. Feeding of children born with cleft lip and palate. Before we go ahead, please do not forget to subscribe, like, and share this link. Subscribe, like, and share this link because this information is very vital. Somebody is out there that needs to know that something like this exists. Somebody needs to know that those children that are born with cleft lip and palate are not cursed. Somebody needs to know that it is not as a result of the fact that they walk in the rain while pregnant, or they walk at night while pregnant, or because of one thing or the other, as they have always believed. They need to also know that these children have that this condition can be repaired. It can be repaired and these children can live like every other person. However, one of the challenge and the most important thing that has been affecting the children that are born with cleft lip and palate is feeding, because yes, feeding can be very challenging in this condition. So as I said earlier, please like, subscribe, and share the link for people to be aware and also to benefit from this information. So feeding of children with cleft lip and palate can be very challenging because of the condition. So when the lip is cut and then open in case of a cleft lip, either unilateral or bilateral, it can be very challenging because the lip is not coming together enough to latch on the mother's breast. No, the lip has to come together to latch on the mother's nipple so that the breast milk can come out into the baby's mouth. So because of this condition, it can be very challenging. It can be very challenging, especially when they are bilateral. And also, even for children that have cleft palate, the roof of the mouth is what is open at this point. Some may have cleft lip and also of palate. So, and the palate, when it is open, that means there's a communication between the mouth and the nose. When there is a cleft palate, that means there's a communication between the nose and the mouth. Some children, when they eat, you just see that what they're eating is coming out from their nose. It is because there is an opening, there is a communication between the nose and the mouth. So yes, it can be challenging to feed children that have cleft lip and palate. It doesn't mean that they are now to be deprived of feeding. And then before I continue, please, I want to emphasize on the fact that feeding children with breast milk is the best. No matter the condition that this child has, either the one with the condition of cleft lip and palate or even without cleft lip and palate, breast milk is the best nutrition that the mother can give to a child. That is why every mother is advised to eat healthy. You don't need to have so much money to eat healthy. You can eat healthy even with the little money that you have and the little that you are earning. So because I don't have enough money should not be a reason why you should not eat healthy. So that one now takes us back to feeding of these children. So breast milk is number one thing to give to children with cleft lip and palate. Because they have challenges does not mean that they cannot feed on breast milk. Now, if you want to feed them on breast milk, you can give it to them directly from the breast to the mouth, or you express. But I'm going to be talking about feeding directly from the breast to the mouth. And that will take us to, I have a little baby here that I'm going to be using as an example. So this is my little baby. So if you want to feed a baby that has cleft lip and palate, normally you want to feed a baby that does not have a cleft lip or palate, you make the baby to sit on the palm, and then the shoulder of the mother will be their headrest. So the baby can be tilted this way. I'm raising this up because I want the camera to capture it. So it's going to be this way. But for children that are born with cleft lip and palate, there might be a little change. And that change is that the children are supposed to be seated in 45 degrees. This is just a baby. Please don't tilt your baby this way. You just have to position them. They are really fragile because they are really small. So you have to position them very gently. And then they will sit like in 45 degrees. At this point, they are sitting on your lap or you feel like your lap is too low for them, you can base it. So because they have to be like in the sitting position while your elbow is standing as the back rest for them. While you are feeding a baby that doesn't have a condition, the palm is serving as the chair for them, while your elbow is serving as the headrest. So they are more like this. But for the baby that are born with cleft lip and palate, they have to sit in 45 degrees. That means they have to sit like in a sitting position. And the reason is because, now you need to understand that feeding of children with cleft lip and palate, first thing that we need to know is that it requires a whole lot of patience. It requires a whole lot of patience. So when you want to feed your child, that is not the best time for you to go and cook, or the best time for you to go and gist or to discuss something. You have to be patient and you have to concentrate on your child at that time of feeding. Now, one of the common things that you can see in children that have cleft lip and palate while feeding is that there is easy aspiration. There is easy aspiration. That means it's easy for them to just swallow something, and then when there is aspiration, there is tendency for choking. There is tendency for choking, and the reason for this is because of the opening, especially on the palate. The opening on the palate will make there to be easy access for anything to just go in there. That is why you have to sit your child in 45 degrees, so the baby is sitting down this way. Of course, I have to raise this up, but of course, so it's like the sitting is going to be a little lower, but I want to raise it up so that you can see what I'm talking about. So maybe you have to be seated like this, like in 45 degrees. So baby has to sit like this, and then you have to put the breast into the baby's mouth and express it slightly, as in you have to press the nipple part, so that it is easy for the child to also suck without too much stress. When you press the nipple part, it expresses the milk into the baby's mouth, and it is easy for the baby to easily suck and swallow without having to stress too much to get the milk out of the breast. Now, we need to understand also that there are some cases whereby the mother may not have too much of breast milk coming out. Then on that one, you may have to meet with a nutritionist or a dietitian. Of course, yes, we are going to bring in one soon. But for now, I'm just concentrating on the fact that when you want to feed your baby, and then you want to feed directly from the breast into the baby's mouth, make the baby sit down in 45 degrees, like they are in a sitting position. Then you put the breast into the baby's mouth, and then you press the nipple gently so that the milk is expressed into the baby's mouth, and the baby does not have to stress to suck the milk out of the breast. And also, if you now want to, in case you want to express the milk, maybe you're not getting enough milk out, and then you want to express the milk, then there is a feeding bottle.